Thank you, everybody. I'm going to pause for a second and let the staff introduce themselves. Who wants to go first?
This is Marcel Easter, Business Information Director.
Latricia Sims, Chief Operations Officer.
This is Scott Stevenson, Quality Initiatives Director.
Mary Brewster, Provider Relations.
Liliana Howard, Professional Development in TS Gold.
And this is Roseanne Fricks. I have the pleasure of serving as your CEO. And as usual, I want to thank everyone for joining us today. We appreciate you taking your time from your very important job duties of taking care of our little ones. So we do appreciate you. We are thrilled to be a part of your world and also very happy to be able to share good news with you. We have a lot of negative out there. It's easy to find in the world, and sometimes you have to hunt for the good news. So you're in the right place today. So thank you for being here, and I'll let Elizabeth get started.
Thank you. Hello, everybody, and again, thank you for joining us. Thank you for loving us through our update of the link. When we first started this journey with our webinars with providers, we, if you'll recall, started out with a weekly webinar, and then we went to bi-weekly, and really with hopes that we would be back to seeing your beautiful faces by now and COVID would have magically disappeared. I think we all know what has happened. So our link expired because we were hoping by the new fiscal year we would not need the link anymore. However, we went ahead and set it up, and here we are. So to start on your agenda, you got a very lengthy email from me yesterday, late last night, that had a lot of information on it. And the information covered your COVID-19 update number 36 from the coalition that had a ton of different resources available and different things that just will support your efforts going through this process with our new norm of COVID-19. And had the governor's executive order most recent release, which was July 7th. So I included that in your update so that you could have a copy of the actual executive order that basically just extended out our state of emergency for the state of Florida until September 30th. That's pretty much what it is. It's a 2-page document that just includes all of the other dates for the state of emergency, the executive orders that were previously issued. So you have that so that you can go back to it and look at it, just so that you can follow along because so much happens so quickly. I think you can relate to that. So talking about COVID-19 and the impact it's having on your sites, I first want to commend you all. We have had a humongous spike in the number of cases that are testing positive. Our parents, first responder parents, in some cases students are testing positive. A lot more people are being tested. A lot is happening, and you are being faced with some very difficult choices to make. Your choices are you can either choose to remain open and sanitize like you already are. A majority of you are. When those of you that come in contact with the case and you're made aware of a positive case, either through a parent or a child, a parent testing positive and the child being in one of the classes, you're making that decision whether or not you should close to clean and sanitize for 1 day or the 14 days. As you know, the incubation period that you've heard over and over and over again says that we are, once you're exposed to COVID-19, you're susceptible to show symptoms between 2 days of exposure and 14 days of exposure. That is what we know now. With that, you do have a very difficult choice to make. Do you close for 14 days? Do you close for 1 day? It depends. That's the answer. And the state guidelines really are, there are the CDC guidelines that tell you take these steps. There is a flow chart that was put out by Child Care Aware that gives you questions to ask yourself when you're looking at your own emergency plan as to what steps to take. If you answer yes to this question, and you go this direction. If you answer no to this question, you go the next direction. So you really want to look back at some of those details that we've already sent in the past, kind of go back to that. What have you added to your emergency plan? State guidelines, social distancing, sanitizing, hand washing increased, taking temperatures at the door, which I'm very proud of a lot of you, because a lot of you have already reached out and said, we're doing this. And even if I don't know that you're doing it, but you're doing it, kudos to you. You are doing everything you can do to protect those families. So the state guidelines, we go back to CDC regulations. Our health department has been a great resource in this. DCF has been a great partner in this. And all together between us, DCF, the state of Florida with Office of Early Learning, and the CDC together, I think Marion County, I'm pretty proud of you. We've done pretty good. And I'm going to say thank you, because Richard is on the phone usually with us, and Avita and some of his team. And I want to pause for a second and see if Richard wants to add anything to that. I know recently DCF hosted, my dates might be off, I'm sorry, every day runs together now. So I can't remember if your DCF meeting happened already on the 10th or it will be happening. But we are working together to make sure everybody stays informed. Now let me pause for a second after saying all that and see if anybody from DCF wants to make a comment or if we have any questions. Richard, you're on.
Yeah.
Hi, Richard. Thank you.
Yeah, thank you, Elizabeth. Hey, Roseanne, how are y'all doing?
Good, good.
Good.
Is there anything else that you'd like to say concerning guidelines if a provider has a parent come in that's been tested positive or home has tested positive?
Sure. We would like for them to notify their counselor whenever they have a verified report of a child or a staff member. Not necessarily a parent that comes in, because then that's just really considered exposure. But we want to know about the verified children and staff members that are actually in the child care settings. Now, I know that kind of goes a little bit against the what the rule says, because it says when two or more have to notify DCF, but we're trying to keep track of these to see how many. And like Elizabeth said earlier, there is a uptick in the number of cases. I think yesterday's report, we had something like 99 staff members and like 70 children across the region who've tested positive in the child care settings, and that just keeps increasing daily. So if you would notify your counselor, because we're trying to keep an accurate count of that, because we're sending that up actually to Tallahassee on a daily basis. Also, if you do, I know a lot of you opened because we were down to 500 closures for the region as of this morning, and back in April we were up to close to 1,000. So I know more of you have opened, but because of the uptick in verified cases, more and more are starting to close. I just wanted to remind providers to contact your counselor if you do go non-operational again, because we like to, once you're non-operational, we put that in care, because then that takes you off the public access, so that parents who are looking for daycares don't have to waste their time looking at providers who are possibly closed anyways. And then, most importantly, remember to notify your counselor as soon as you reopen. That way we can put you back on the public website. Something else we're doing right now because of the uptick in the virus, we have gone back to telephonic routine inspections. Now we're still doing the renewal inspections in person, but the routine inspections to reduce the risk to our counselors, we've gone back to our telephonic routines. And then hopefully most of y'all were able to attend the our provider webinar back on Friday. I wasn't here, I was out of town that day, but what we did, we collected a lot of your questions, and we're creating a Word document with those questions, and then we're going to have answers to the questions, and then we're going to be sending those back out in a mass email to Circuit 5. So, but if you have any other questions, feel free to contact me. I think most of you have my email address, or you have Avita Rosa, who's the supervisor over at Circuit 5. So just continue to send your questions to us, and we'll try to answer them the best we can. That's pretty much all I have.
Thank you, Richard. And I guess the bottom for our providers on the who are directors, operators of businesses, and your decision is your decision. We certainly will assist in providing items for you to think about or specific guidelines, but if you should encounter a situation with someone positive, how you handle it is in your emergency plan, we know, and you will handle it what is appropriate for you. We do know that we have had some providers that have chosen to close for one day to do an intense, in-depth cleaning. Some have decided to close for a week or 2 weeks for the same thing and to assist with quarantining. But there are definitely options out there, and no one is ordered or directed to do any type of action. That is your business decision to meet the needs of your families that you provide services for. So thank you so much, Richard, for that additional information and reminding us of those things that are in place.
Yep, you're welcome.
Sorry, Lucy.
And just to, no, you're good. That was excellent information. Thank you. So just to kind of go along with what Richard said, when you're sending your closure notices to your counselors, please also include the coalition because we have to track that for multiple purposes. We send an email daily up to the Office of Early Learning because they are required to track your closures and the purpose, the reason why you've closed. And the other thing is it highly impacts your attendance. So we need to make sure we know those things ahead of time so that we can make sure that we accurately track when you were open and when you were closed to show the correct data on your attendance rosters at the end of the month. So on your agenda, then moving on to B, under COVID-19 update, I just wanted to kind of reiterate some of the end dates for some of the special circumstances that have occurred around COVID. And I'm going to give this little caveat. I have to step out of the room at about 1:25 because I have another meeting at 1:30. So our team is going to take over from there, and we will get together after this and make sure we answer questions. If they can't get answered right away or we have to research them, we will get back to you. But just a couple things I want to bring to your attention. You know, we're still enrolling families in the first responder essential medical personnel program. We are enrolling families until July 31st, and we're able to go back retroactive to July 1st because we're in the new fiscal year now, so we don't want to cross fiscal years with going retroactive on those referrals. There are a couple of families that are coming through now. We are doing the best we can to renew the referrals that have been in place from April 1st and that expired on June 30th. I mentioned last time we talked about this that we have more than 400 families that we're working on renewing those now. And those 400, those are the ones that were enrolled April 1st through June 30th. We still have an additional 200 families already enrolled or in the process of becoming enrolled in this program in Marion County. So we ask for your patience. We will start their services they'll either be July 1st or the day that they start in your program. Going back to parent copays, for the month of July, we will continue to cover parent copays, which means you would only charge those parents, actually all of your parents, you would only be charging them your differential fee if you have one. Okay. As we're talking to new parents coming in, we're letting them know. You need to upload documents when you're asked to because we have a deadline of For the ones that are currently enrolled, we have a deadline of July 17th to ensure they can remain enrolled. For new families coming in, we try to make it very important on their to-do list to make sure once we get them enrolled that they follow up and upload the needed documents into their parent portal in EFS Mod. Otherwise, we can't continue to keep them enrolled because we don't have the documents that we need. We're also letting them know that effective August 1st, they will be needing to pay their parent copayment. The parent copay is listed on their certificate of eligibility that's in EFS Mod. You can see that certificate just like any other parent when the parent enrolls or logs in and accepts the terms and conditions. You can then see the certificate, and the parent fee is on that certificate. So effective April 1st, you're going to be collecting the differential fee and the parent copay. August 1st, sorry, effective August 1st. I don't know what I said, sorry. I said April. Oh, look at that. I'm going back in time, please no. So August 1st, you're going to collect those parent fees and the differential. So please, please, please do everything you can to let your parents know about the uploading of the documents needed, the acceptance of the terms and conditions, and the parent copay that will become effective August 1st. For some of your parents, it's going to make a big impact. Some of your parents, because of their income, they are assessed the highest parent fee. That's going to have a big impact on them. It's going to change things almost overnight from what they paid the last week in July to what they'll pay for the first week in August. A couple of other deadlines that we need to talk about: child assessments. So that's your class observations. If you'll recall, the class observations for the end of, for the ones that we stopped doing them basically in the springtime, okay? We stopped doing your class observations. It was waived until the new fiscal year started. Now we will have to start doing them again. We are watching COVID, so we haven't made a decision on when we will start those back up. But if you did not receive a class observation in the springtime and you are a school readiness provider, you will have to receive one for the fall, in the fall sometime, so that we can enter into your new contract. Scott is going to talk about that in more detail a little bit later, but I wanted to make you aware that that waiver has expired effective June 30th. The second thing I want to make you aware of is the ages and stages questionnaires. You all know them as ASQs. You'll also recall ASQs were waived from March 23rd until June 30th. So any child that was enrolled into your program, to kind of summarize your requirements, are to complete your ASQ within 45 days of initial enrollment and annually upon redetermination of services for your children ages birth to 5. From March 23rd until June 30th, that requirement was waived. So beginning July 1st, you will have to, any children that came into care from July 1st and on now, will need to have that ASQ screening completed within 45 days of their initial enrollment. So if you got them, you still have plenty of time. If you got them, and VidMary is still sending her emails to you in Blue Jean reminding you of who needs the ASQs completed. So let me pause and see if we have any questions. I just gave you a ton of information.
Yes, we do.
Okay.
Okay, first question is there a place that will come out and test our entire site? I'm assuming it's going to be a COVID test.
So if you're talking about COVID, our suggestion would be to contact the Department of Health. Please understand they have a high number of requests for this right now. So you may even think about reaching out. If you've been tested somewhere other than the health department, you may think about reaching out to them and see if they would offer that service to your site. Let them know you're a child care facility and that you'd like to have your entire team tested. See if they'll come out. You never know until you ask.
With the emergency order being extended another 60 days, is the August 1st parent fee likely to be extended another 60 days?
We do not have any directives on that right now, so we're telling you what we know today. As you know, this changes daily and sometimes hourly with the number of cases and the different things that we receive. OEL has been very diligent with keeping us up to date, typically on a Friday. So once we, if we get the directive to extend it, we'll definitely let you know as soon as possible, because we'll have to share that with the parents as well.
So I believe they're just reiterating 8.1, all parents pay the parent fee and the differential.
Correct. Starting August 1st, parent copay and the differential. You find your parent copay on the certificate that's in the portal.
So all COVID first responders and emergency personnel need ASQs too?
That, I do not believe we do have to do that. I can double check on that, but no, I don't think you have to do that for them. Trish is writing down, so she's going to help me remember that question. Yeah, Trish? Thank you.
And to expand on that, there was another question in the same thing, except it states that were enrolled in April. ASQ, if the child is not attending due to COVID, what do we do?
You would continue to, that's one deadline I didn't talk about. The reimbursements based on enrollment, we do have clarification that you will be reimbursed based on your enrollment if you're open, as long as you're open, until July 31st. So for those kids that were absent due to COVID, you're just going to, it's right here, black and white. I'm getting a look, guys. But I have it right here. So this is, of course, again, this is what we know now today. The sites that are closed, we are still trying to determine, we go week by week on whether or not you'll have to complete that closed provider questionnaire. But yeah, we will, as of right now, if a child is absent due to COVID, you're going to still put that in just like you have since, March, April? Yeah.
Okay. Does the parent fee include the frontline workers that was not already on the program?
Yes, it's everybody. So your parent fee kicks in for all school readiness enrollments.
What is the last day for the first responders?
July 31st.
For enrollment?
July 31st. All right. The last thing that's on here is for under COVID, I'm going to say this real quick because I'm going to have to run out of here in just a second. I'm going to skip down on our agenda, but face masks, we do still have them available. You'll want to contact Susan Dewey. Her email is getting fixed, so thank you guys for testing that out for us. We were just seeing if you were paying attention. But we appreciate you letting us know that that wasn't working right, so we are working on getting that fixed. We do still have masks available. We do ask if you've already received your masks to hold off on making another request for a couple of weeks. Let's get the providers that haven't gotten their masks first, and then we will still go a second round because we should have enough. The other thing is you have a survey about clear masks in the email that I sent you last night, and I forwarded again today. There's information in there about the background and the data on being able to see children's faces, and the Florida Association for Infant Mental Health, say that 5 times fast, is conducting a Faces Are Essential campaign, and it basically talks about how the brain connects in a young child, if they cannot see their caregiver's face, and going for 8 hours a day without being able to see their teacher's face, or even more sometimes, can have diverse effects on the brain development and how a child grows and develops and the connections that they're able to form with their caregivers. So please take that survey. I was made aware if you have multiple sites that you represent, you'll just have to fill out the survey for one, or there should be a place where you might be able to type both sites into that area, so we can make sure we get you the right. We'll let you know what happens with that. Right now we're just collecting information. I do have to run to another meeting, so we are further on the agenda down under VPK. I was in charge of talking about VPK Assessments. Basically, Bright Beginnings FL, that's where you want to go to order your assessment kits. You will be responsible for completing VPK assessments this year within the first 30 days of your program starting. And then you'll have 15 days to make sure it's entered into Bright Beginnings, which gives you a total of 45 days to get them done. So that's for assessment 1, AP1. Those of you that are in quality improvement plan, you will have to participate in AP2, which typically happens around January, and we will clarify those deadlines for you a little bit later on. So, because right now we're only worried about your first one. And AP3 then will be due within 30 days at the end of your program, and then you have 15 days to enter it into Bright Beginnings. If you need a new assessment kit, you can request one through your Bright Beginnings. It's brightbeginningsfl.org, I think. And I believe there are links in Blue Jean, I believe. I meant to check it before I came in here. I'm getting a thumbs up and a nod. So there's a link in Blue Jean to it. There's also a link maybe on our website to it. If not, OEL's website has it, and we have staff that can help walk you through it. Certificates of eligibility for VPK, the submission process is the same as it was last year. So if you need more information on that, just let us know, and we will do that. With that, I'm going to say goodbye, everybody. I'm super proud of you, and I will catch you later. So, Mr. Scott, you want to take over?
Well, before we take over, I know she's leaving, but I think we can answer a few questions that are there. Are the masks for the students as well?
The masks that we're distributing can be used if you so choose to let your students wear them. That's okay with us. We have quite a few in stock, so we're able to give out high quantities to the providers. So it would be probably more than enough for your staff. So if you do want to pass out some for the children, that would be fine.
Although let us clarify that they are not specifically children's masks.
True.
They're adult masks. So take that into consideration for fit purposes.
Next question, while we talk about masks, moving forward, what will we do as our supplies begin to run out? Gloves, cleaning products are getting very hard to find anywhere. Can coalitions use some influence over ordering products from suppliers?
Well, I can say this. We definitely have plenty of masks in stock, okay? So as Elizabeth said earlier, we're trying to get those out to those providers who have not yet received them. We do expect to have a round 2 because we have quite the inventory of masks. As for cleaning supplies, we had several of those in the office, and I believe all of those have been distributed at this time. We could possibly look into another round of ordering some supplies if we had enough demand from the providers. So if this is something that you need or would be interested in, you can email me and let me know what your site is in need of.
And again, I'll just follow up on that, Scott, if I could, and say that, yes, please keep us informed, because I do sometimes receive phone calls from other people in the community that say, what are you looking for, Roseanne? What are you hearing? What are your needs? So just bombard us with emails. And if cleaning supplies are once again a challenge for you to acquire, be specific. Tell us specifically, what is it? Is it, is it Clorox? Is it the wipes? Is it disinfectant spray? What are you specifically having challenges locating? And I did receive a call this morning asking me that question. So please, please, please communicate and keep us informed.
If a parent is already school readiness and now is an emergency essential, how do they get that care?
As long as they still have their 12-month eligibility, once the first responder and essential child care authorization runs out, those parents will be transferred back to their regular BG8 billing status.
Do we know when we'll hear back about the latest grants we applied for?
Absolutely. I'm actually going to get into that on the agenda here in just a few minutes, and I'll tell you more about that.
Most of the other comments on here is Lysol, disinfectant spray, and gloves. We are finding the hardest problem right now is for gloves. Another provider said that the masks that they did pick up from us, they were too big for many of her students, and that's because they're designed more for an adult, but you may be able to adjust the little earpieces for smaller heads.
Okay, Lysol, and what else, Marcy?
Gloves.
Gloves, I got in Lysol, what else?
Wipes and Lysol.
Okay.
Gloves and Lysol. Okay, are we on number 3, Scott?
I'll go ahead and go over the mini grant number. Okay, so this is a great opportunity. This is a positive thing. I get to be the bearer of good news. And I guess most of you hopefully by now have seen this. I sent the email out last Wednesday. This is the new CARES Emergency Funding for Child Care Providers mini grant. And it's another excellent opportunity to receive some financial assistance from OEL and DOE. The grant amounts are anywhere from $1,200 to $20,000. This is good for not only our contracted providers, but also our non-contracted providers. And up to now, I've gotten an overwhelming response. We really don't want any providers to miss out on this opportunity because it's the application process is very simple. They've kept it very short. And the only caveat, I guess, to this whole process is that we weren't given a whole lot of time for this particular mini grant to turn around, roll these out, and get them processed. So if you haven't already, we need to have your application for these submitted by this Friday, July 17th. Again, I think I want to say at least 80% of you have responded and sent back your application, so thank you for that. Essentially, I mean, I can go over what the grant is, but really it's to provide care, to provide support to providers who are going to reopen or have reopened. And really the biggest eligibility piece that they're looking at is, were you open for business on April 30th? And were you contracted with us? So really you could fall into one of 4 different categories, but any category is still eligible for an award. So if you have not submitted your application, please do so today.
And out of counties will need to contact their base coalition?
Absolutely, that's correct. Out of county, we cannot accept applications for our out of county providers. They would have to do that through their home coalition.
They can't hear the question. Repeat the question.
The question was, what is the turnaround time to get these funds to our providers, which I think was the question earlier that Marcy mentioned to me. And I'll let finance answer that one.
Our goal is to actually have the payments out. Let's try the calendar by the 24th of this month. So that's why we set the deadline for the 17th. So we'd have a full week to turn around and process the request.
Were there any other questions? No. Okay. Yeah, that one's pretty straightforward. And again, a great opportunity. We've had several providers who are going to get, $20,000. So please send me your applications. Also, if you'll notice on the agenda on letter C, there's a Flacey webinar that's going to be held this Thursday, and it's going to just basically give you some general information about this grant. We encourage you to get on just to hear about what the grant's all about, and it's just a good resource and good chance to get some more information on how these grants are how they come up with them, and what some of the eligibility requirements are and so forth. And it looks like there is a link on your agenda to go ahead and register for that webinar.
Okay. So this is Marcy. So I'm going to go over a few things that we've had some questions on in MOD here lately. If you are looking at your payment certificates for newly enrolled or anybody who has actually redetermined during this time, you are not going to see your private pay or your provider rate on those certificates. The reason why you're not seeing those rates on your certificate next to where the parent copay rates are is because Scott's team is in the process of getting all those rates into the system. The way the contracting has happened and was delayed this year has delayed that information getting in, but that information will be in by July 31st because we have to run reimbursement. So be expecting those to populate after that. And the same for those of the providers that actually have gone on and have tried to do their July attendance. Your holiday for July 4th, which would have been on that Friday, is not in there either for the same exact reason. As they're going through, they actually have to put your contracted rates and your holidays into the mod system by provider. So all of that information has to be completed by July 31st in order for reimbursement to run smoothly. Contract amendments, Scott?
Yeah, I can take that one. So a couple weeks ago, we did initiate and we rolled out the contract extensions for school readiness. That was done and finalized a couple weeks ago. So really, we want to keep you up to date as to that process and how we're going to get to your new 2021 contracts. So the next step in this whole process is letter C there on the agenda, which is your contract amendments. So what this means is we're going to have to do contract amendments for all of your 1920 school readiness contracts. And what this will do is it'll amend your current contract to include the information that you put in EFS mod for your 2021 contract. That's a little confusing, but as of July 1st, all the information you put in EFS mod was for your 2021 profile. So it's going to take that information and amend your current 1920 contract to include that new information. So these amendments, they have to occur before we can initiate your new school readiness contracts. And as Elizabeth stated earlier, we also have to do your class observations before we can initiate your contracts. So several of you did receive a class observation in the spring. So once we complete your amendments, we'll be able to move forward initiating your new 2021 contract. But for those of you who have not yet received the class observation, we are going to have to wait until that is complete. And again, as Elizabeth stated, because of the spike, we're kind of putting those on hold right now. We want to make sure that it's safe to go out to deliver those observations for everyone. So just know that it's coming and it's coming soon, but we don't want to jump the gun with the cases being the way they are.
And the other piece that we're waiting on for the amendment is OEL at this moment. So the quality team will start processing those amendments in the system once OEL releases them.
Exactly. And I think that takes care of the next agenda item D. The ages and stages is what Elizabeth already spoke to. She was just letting you know that that waiver has expired. It was good from March 23rd through June 30th. So again, as of July 1, you will be required to do those ASQ assessments. The next piece actually was one that we had talked to. Elizabeth was going to talk about withdrawing children. I'm not you can. Okay.
I can take care of that. Okay, and Latricia, you jump in where need be. So one of the things we're going to reiterate that we are pushing effective the July 1st, we talked about it 2 weeks ago at the last provider meeting, is that for providers to go ahead and start withdrawing their children out of the system when they need to be terminating your children out of the system. Now, there are certain reasons why you can't terminate. One of them would be that the parent has not signed the certificate. So with that, you would have to then upload your withdrawal form into Blue Jeans, and we would be able to process that for you. Other than that, you will need to go into your enrollment, over to the right-hand side of the screen where you view the certificate for your children. It states terminate underneath it. And that is in the EFS mod under your enrollment screen. So that is highly important. You need to make sure you do that before you do your reimbursement. Those are the pieces that have to be cleaned up. The other piece, please remember, I'm going to mention, and it's not on this agenda, is we are now, when we enroll a child, we are having you accept those children. We are no longer enrolling on behalf of the provider. This is going to help keep your accounts clean to make sure those children show up at your site before they're actually fully enrolled.
And when are we putting this in writing to the provider, or have we?
They have on Elizabeth's provider update email.
Okay, so you will find the details of what Marcy and Latricia just shared with you on Elizabeth's provider updates. Share them with other providers that may not be on the call. We understand that everybody on the call is not inclusive of everybody who is a part of our big team out there in Marion County. So please share that information, and I know that sometimes seeing it in writing and doing it is a little bit easier to follow. So thank you. Latricia?
Just to add to what Marcy was saying, keep in mind, if you have a child that is enrolled that has 5 consecutive absences with no contact from the parent, you are required to contact the coalition to let us know so that we can attempt to reach out to the parent, as well as if you have 10 unexplained absences, you should also be making contact with the coalition. And we will send this information out with Elizabeth's provider updates, the rule that references all of this information.
A provider has come and asked, if we withdraw the child, we will not be paid for them. If the child is moved, or you know the child is not attending due to COVID, if the child is not attending due to COVID, that is fine. You do not have to withdraw those children or terminate them. But if the child has moved, or you know the parent has unenrolled them from your center, then yes, you need to. Because typically the parent will eventually call us and ask, and that's when we have to go back and do adjustments and take money back from you if we have paid you for this and the parent has unenrolled those children. So we're just trying to keep those pieces as clean as we can starting this new year.
Any other questions, Marcy?
No, that is it.
Okay. So next on your agenda, we want to talk a little bit about VPK applications and the contracts. Right now, I've initiated VPK applications for all of our providers. So at this point, we've only been able to go in and approve maybe 20% of those. So we need those done ASAP. We are absolutely aware of a glitch in the system that is preventing some of you from entering your classroom information. So just know that we are aware of that and that we have a ticket up to OEL for that to get a fix for it. So the ones that have been approved, I'm going to go ahead and start initiating your contracts. And for the ones that we have approved, I'd like to get all of those done really by end of next week at the latest. And the others, as we approve your VPK applications, we'll go ahead and start initiating contracts for those. So just know that if you are a VPK provider, that the signing of contracts and initiating of contracts is starting to happen now.
I would like to reiterate for those providers that are, if there's any additional providers that are having issues with entering or having the system save your classroom as you enter the information, please let the quality team know so they can let myself know, so we can track that. So when OEL has the issue resolved, I can test the accounts out to make sure they're good to go.
And I was just reminded also, when you're completing your VPK application in the portal, you do have to sign and certify it. So that's a final step in the process. And I guess if some of our quality staff are assisting you, they're finding that that step is being neglected or being forgotten about. So just don't forget to sign at the end and certify it, and that'll kick it back to us to approve it.
We do have a couple of questions, Deanna. I know this is more yourself than I. Any news on when OEL will send the VPK end-of-year reconciliation for final payment? We have actually been working on that through the weekend. Those should be going out Friday. The letters, or no?
We were going to work.
We are finalizing those pieces, and I will have Elizabeth send out an update when we get a final date. We want to make sure that these reports are accurate, and so we will update you with that date.
We were supposed to be paid today, so
Friday might be not quite realistic, and just don't have quite enough hours in the day if we need to probably reach that Friday deadline.
And of course, those reconciliation for the final payment is still affecting the May VPK and some of the June whose classes went into June. Okay. Those of us who cannot enter classroom information, will we be informed when it is corrected, or do we need to go into the portal every day? No, we will inform you as soon as that has been corrected on the providers that are having some issues uploading or having their classrooms saved in the VPK app. Next question is, what do you do when school restarts and the parents decided to homeschool when they're enrolled with you? This question has been presented to OEL. At this time, we do not have guidance from OEL on that. We will keep you informed as we are informed from OEL on how they will be handling that this year. I have a provider who is still unclear on first responders, which was first responders extended for 3 more months. First responders, we will be enrolling till July 31st. They will have 3 months worth of service eligibility once they are enrolled. So right at this moment, our last enrollment would be as of July 31st. Anybody who is enrolled as of the 31st will have 3 months after that to be on that program. That's all the questions.
The remaining items there on VPK, Elizabeth touched on the kits and entering the assessments into Bright Beginnings. That was letter C. And D, I'm not really sure what we were going to. Certificates of eligibility.
Certificates of eligibility. So the certificates of eligibility are going to be handled the same exact way that has always happened. You will need to go into EFS Mod and place that child into one of your classrooms. When that is completed, you will need to upload the signed COE, signed by the parent and the provider, into your Blue Jeans portal. We cannot confirm those children that do not have signatures on those COEs in order to activate those children for your VPK classes. Highly important. Make sure both signatures are on there before you upload them into Blue Jeans.
And then the last items, we just wanted to reiterate these resources that were found and were included in Elizabeth's email. You can find links to those resources in that email. We thought they were absolutely worth mentioning and encourage you to check those out.
Okay. That's it, Scott? That's it. Latricia? Okay, we've got a few minutes. If anybody has any additional questions, if you want to go ahead and type them in now, we'll see if we can answer them for you. And then this is a question. If you guys have Scott's email as well as Elizabeth's email, so whoever you send the answer to will get it over to me. This is something that your team hasn't even heard about yet, and I love it when I do this to them. If you would, or if you are so inclined to provide me with a little bit of information on how are you feeling as business owners about the future of your business at this moment. This is a pretty hot topic, not just locally, but it's statewide as well as federally, as far as childcare and the tomorrows for childcare. So as business owners, do you have any concerns? If so, what are those concerns? Are you concerned about children continuing to attend a child care? Are you concerned about having too many children? Do you have a wait list now of families that are looking for child care options? So what are your concerns, and what do you think is going to be your biggest challenge with being able to continue to conduct business in a manner that you want to do so? The level of quality services that you provide, your environment, your facility, do you see any potential financial challenges with that, or things that would possibly cause you to have to reevaluate how you're currently providing services? So if you could answer that, a short answer, but in an email, that would be good. And you can just put in the subject. How about put in the subject Roseanne? And that way the team will know when they get the email that it can go over to me. I'm just collecting some information. Again, I have conversations with a lot of different people at a lot of different levels, and this is a topic that has come up recently, so I would appreciate it.
Okay, so I do have a couple more that have come in. One is a question, someone's asking where you find your EFS profile ID. On your provider dashboard, in the middle, down at the bottom, it says Provider Site Summary. It also states that there is your provider ID. So you'll have your business name, you're doing business as, your provider ID number. The next question is going to be, oh, no, that one's not it. Where did it just go? There it is. Sorry. For those of us who have already received our 1819 reconciliation, did that include PFT and class differentials? The answer to that is yes, it did. Mary, did you have a question?
Well, the mini grants are asking for profile ID numbers.
That's it. Provider ID.
Profile is different. Profile.
Okay.
Okay, so I think that we're getting a little bit of clarification for
have them use this, because I believe that's going to be something you guys fill out, that we have their profile ID. They don't see it. It is a profile ID. They don't see the profile ID. Go ahead and email Mary for your profile ID, and she will give you your number on that. Okay, additional questions? Yes, first responders will need to pay parent fees as of August 1st. Yes, we did talk about the July holiday and EFS mod. That will be in your system, available to be seen by July 31st. How cases that arise in our center will negatively impact our program financially? I think that is
the response.
Yeah. I think that's one of her concerns.
Okay, well, you're printing all these stuff,
Yeah.
the stuff, Marcy. Okay, so she'll get that to me.
Good question.
And if you would, when you email me answers, or your thoughts, ideas, concerns, etc., you know, if you have ideas on solutions, put them out there and make sure that I know how to contact you. I know that sometimes your email addresses may not exactly line up. It's easy for me to understand anyway. So if you could give me a good contact information, that would be absolutely wonderful. And I know that this is certainly a time for all of us to be creative as we meet needs. So thank you.
Next question is, what is the time frame for receiving the 1819 reconciliation letter?
They're being worked on as quick as I can. Again, I'm looking for a few more hours in our days, but my goal is to have the letters completed and out to those of you that may not have received anything from me yet by the end of the month. So you hang in there with me. We're getting through them.
Have all the checks been released for 1819 reconciliation? And
For those that we owed money to.
That we know as of right now. We remember, there's still a couple of you that we have a little bit more work to do. So the majority of you, yes, most of the checks have been released that we are aware of. We're finalizing efforts on a few of you, and then there certainly are those providers that we did overpay that we will be contacting you to work out plans for moving forward with the collection of those funds. Any other questions, Marcy?
Where do we find the parent fee for the first responders? Is that showing up on the certificate? Look at the certificate, and you should be able to see the parent fee for every child that you have.
Marcy, what did you write survey for?
Your question, if you want to put it out in the survey to have it all in place, but it's okay. FYI, the ID is in the class assessment website. But I don't think that's the same. I think that's the provider ID, not the profile ID. Is what's in the class assessment is the provider ID, what I just showed them, correct?
Yes.
Okay. Okay. If VPK contracted only, are we considered contracted for the new grant year?
What if they what?
So they're a VPK site only. I believe you addressed this, that you have put out all the VPK applications and you will start processing the contracts for VPK.
Yes, absolutely. Yeah, so some of the VPK apps that I've received have been able to be approved. And for those, I'm going to go ahead and start initiating contracts. The contracts haven't changed since last year. And once we start that process, we usually can get them all signed by both parties within a couple days. So if you have submitted your 2021 application and it's been approved, then we can move forward with your contract. If you're one of these providers who has not yet submitted your application and it's been approved, or maybe you're being held up by this glitch in the system of not being able to enter your classroom information, then we're taking those day by day, and as soon as we get those approved in the system, we'll get those contracts initiated.
So in other words, for the current fiscal year, you do need to have a completed application and a signed contract. Without those two documents, you are not considered a contracted VPK provider. And again, we understand that we still periodically have a few challenges with EFS mods. So we're going to work through this together. And we certainly hope that all of you that provided VPK services last year will continue to do so. And we'd love to have a few more of you consider that opportunity for this upcoming year for our 4-year-olds.
Once again, they're asking for the provider ID, the 5 numbers. Contact quality on the profile ID for those grants that got sent out last week, so they can make sure they get your correct ID number in there.
When you log in the portal, your provider ID is one number. You're always going to have the same provider ID. Your profile ID is specific to the contract year. So you'd be looking at your 1920 contract year to get that profile ID. So for every profile, contract year profile you have in the system, there's going to be a different number. You want to select the profile ID that matches your 1920 contract year.
All right, we know that we're right at 2 o'clock, and again, we'd like to be very considerate of your time. So we do thank you for attending the call today. There are some resources that were sent out with the agenda and other materials that we encourage you to take a moment and review. Please, please, please feel free to email to us. The big key here, of course, is communication. We can communicate with each other, but if we're looking for an answer to a specific topic, then we need to make sure we communicate with the person who's responsible for having that information. And if it's something that you need from the coalition, that's what myself and my team are here for, is to provide you with the information that you need at any given moment, understanding everything is subject to change. Marcy's got her hand up.
One last thing that we haven't mentioned, and someone did remind us, registration fees.
What
Save up my existence right at this moment.
Go for it, Marcy.
We are working on registration fees, actually effective this week, since we are now finally, as of this morning, closed out of SR and VPK attendance. That was my first priority for you guys this month, was to get June taken care of so you could get paid. And we are working on determining those kids and those providers that will be receiving registration fees. So hopefully we'll start seeing it trickle by the next, your next payment period after this one.
All right, well, thank you again so much. We encourage you to please take the appropriate measures to stay healthy. Wear masks when you're out in public. Sanitize your hands. Do not be in closed environments, social distancing, all of that stuff. And keep us, please, please keep us informed, communicate with us, and together we will be successful and get through all of these opportunities and challenges that we currently have. Have a wonderful afternoon, everybody, and we'll talk with you soon. Thank you.